Hello there, Pattaya. It's Dr. Ian, and today I'm at the Bangkok Hospital, Pattaya. My special guest today is one of our senior orthopedic surgeons, Dr. Cherdchai, and we're going to talk a little bit about hip replacement. Welcome to the program, Dr. Cherdchai. When we talk about hip replacement,
yes,
how much do you actually replace?
maybe you can say just nearly 10 cases a year.
Right. Now, are hip replacements common after a certain age group?
Yes, mostly we do the replacement in elderly people because we found that for younger people, if we do the replacement, the failure is quite high because of the activity of young people, and because mostly people who need replacement come into the middle age and elderly group. So you can say mostly we do the replacement in people older than 55 years old.
I believe there are two main reasons for having to do a hip replacement. One is generally wearing out, so the joint wears out.
Degeneration.
And the second is through trauma, where the actual hip joint, or the head of the femur becomes knocked off, becomes fractured. From your point of view, is there any value in hip resurfacing for people who have got joints that have worn out, rather than a total hip replacement?
Actually, hip resurfacing became popular in this last 5 years, and just about 3 years in Thailand. They proposed this hip resurfacing because they thought that it's more naturality, because you just replace the cartilage and a thin cup of the bone.
So, going back to a total hip replacement, how long does that last?
For conventional total hip replacement, it lasts more than 10 years. In some cases, maybe 15 or 20 years.
And the hip resurfacing, generally, how long does that last?
Because it's just a new concept, new technology. So until now, we expect also more than 10 years.
Right. So for these people who've had hip replacement or hip resurfacing, can they expect that one day they are going to have a total hip replacement?
Yes. That's why hip resurfacing popular, and we can use it for younger people, right? Because we know that younger people who have hip resurfacing, and maybe next 10 or 15 years, maybe they need total hip replacement for the first time, and then maybe next 15 years, they need total hip replacement on the second time. Also, for hip replacement, now we have new technology come together with the resurfacing. Resurfacing actually is not a new concept, but because of the new technology and new material, we use a big head and also a new type of metal. Then the wearless is slower, have excellent wear resistance, so it lasts longer, and the complication from hip dislocation is quite low because of the big head. Then we use this concept in total hip replacement also. The new concept of total hip replacement, we use big head with metal head and cup. So the complication also lower.
Right.
Yes.
Like all things, Pattaya, medicine is evolving. It is becoming more highly technical and more highly complex. but always remember that a human being is the person who actually does the operation. Dr. Cherdchai, thank you very much indeed.
You're welcome. Okay, thank you.